Hello, I'm back. And I am back with a question. So the headaches have been excruciating. My headaches have been excruciating. And I have a question for you. Since I have been having quite frequent lumbar punctures, my only CNI is actually stable. And since my CNI is stable, what I mean by that is it's in no danger, no seemingly danger of going blind. And we all know that with idiopathic intracranial hypertension, this is always, always a little bit of touch and go. Since this is an issue, would you have surgery only for your headaches? So that is the question of the day. And the reason why I bring this up is because my pain specialist has now said he has reached a dead end with pain medication. He does not know what else to offer me. So what does that mean for me? What does that mean for me on a daily basis? My headaches are waking me up in the middle of the night. He has actually suggested that I wake up at 3 a.m. and stay awake for an hour to try to see if the CSF fluid will lower enough, and that will help. So far, it hasn't done enough. He has offered to take Tylenol. I believe we understand Tylenol is not enough. I don't know what your experience is. It's not enough for me. Hasn't been enough. So the question is where to go from here. He has referred me to a neurosurgeon. I have had yet another MRI, MRV with contrast. And here's my issue, and this is very personal. I have had too many right side VP shunts. Hence, that is not viable for me anymore. And I say right side, and I understand this is your left side, so you have to mirror a little bit. I have hemorrhaged on the right side. My right ventricle is practically collapsed. Not collapsed, but practically. So he has suggested the left side. The problem is my ventricle is too small. So it is a one-shot deal. In other words, I am not viable to do any revisions. And I am prone to need a lot of revisions. It is at a certain time I was needing revisions every 90 days. That's 90. Every 90 days on my right side. So you can imagine, I went through a period where it was one revision after another, after which my shunt just started getting infected, and they had to take it out, and it was just no way. And don't get me wrong, then it was LP shunts. We've tried it. We've tried it all. And so they're talking about going through the other side. The issue with the left side, as I'm sure a lot of you know, is that it can affect the reasoning part of your brain. And so with me and with my luck, there could be a chance. Fortunately, I don't have clotting in my history, so there's a chance that I may come out unscathed, but it's risky. It's risky. Plus, there's a neurosurgeon talking about doing what's called a septal fenestration, which is to communicate the two. See, words come and go. Have you experienced this by any chance? The two ventricles. And so that way there will be more fluid in the two ventricles. The problem is, of course, as I just mentioned, my right ventricle is almost collapsed. So again, he mentions that there is a high probability that he would be touching some brain matter in doing this, causing some damage to my processing. Not the likelihood of something that I would enjoy. This is a very risky, what should be a very simple surgery is very risky in my case. So question, would you do something like this? just for your headaches. Now, please be aware, when I say just, that word, I don't mean by any means that my headaches are not the most painful thing. I am going through one of the toughest periods of my life. Believe me, I have gone through a lot. What I mean is, I'm in no imminent danger. My life is not in imminent danger, except for me taking my own life, right? I'm not suicidal, that's not what I'm saying. What I'm saying is that my illness is not about to take my life. So what do I do? What do I do? Do I go through a surgery that may take my life in the way that I know it because of my reasoning? I'm already taking Topamax and other medications that make me dopey. Do I allow a surgery that could make profound damage? And if it were to do no damage, and I went home yippee came home unscathed. We do know shunts break. We do know they clogged. So, for how long? And then what? So, would you do this surgery? That's my question. I would love to know, because at this point it's a conundrum. And if we're dead end road on medication, what does that say about our medical community? Not that I'm criticizing them. I understand that this is very difficult. And please understand, I don't want opioids. I am not in opioids. I am not asking for oxycodone. I'm not asking for morphine. I am not asking for any of it. I don't want any of it. I've been down that road. It's still, I'm asking, what does that say for our medical community? What does that say for those of us that are in chronic major pain and that have been in chronic major pain? Do you hear a little bit of anger in this? Well, perhaps I'm in major pain. Major pain brings an edge. I have been coping with meditation. At this point, it's even hard to sit to meditate. I still do. But it's hard. In meditation, we talk about going either outward and focusing on something else, or going inward and actually facing the pain. It's hard right now. I'm not going to lie, it's hard right now. So I'm going to keep moving forward, and I'm going to go in and deeper. And I'm at a point of introspection and searching. I'm just curious. What's your take on all of this? Thank you.